Good afternoon and welcome to the Monday My Turn myCAvax office hours. And I want to say this is the final Monday My Turn myCAvax office hours of a ongoing series that many of you have been attending for, oh goodness, a couple years now. And this final session is today, Monday, September 18th, 2023. We'll be together from 12 p.m. to 1 p.m. or as long as your questions are coming in. And as we move on to the next slide, on behalf of the California Department of Public Health, I would like to welcome you. My name is Leslie Amani, and it is my pleasure to facilitate. And I am joined by a wonderful webinar support team of Cecilia Lavu, Michael Fortunka, and Diane Evans. We are here to support the questions that are coming in by inviting you to open your Q&A double talk bubble icon that you can see on the screen. And you can also make comments using that icon as well. To the right of that in the chat, we will be dropping links shortly, and we're getting our link ready for the slide deck. So if you've just joined, don't worry, you did not miss the link. We're going to drop that into the chat for you shortly. And of course, reactions are always welcome. So as we move on to our next slide, a reminder to our panelists today, please mute yourself when you're not speaking and do monitor the Q&A panel for questions you may be able to answer. And attendees, this is a reminder to all of you that today's session relates to My Turn and myCAvax specific questions. So if you have other program questions, this would not be the call to ask them. We want you to ask anything related to My Turn myCAvax, and we have a group of subject matter experts on the call waiting to help answer those questions. And of course, we'll do our best to answer them in real time. Another reminder that we do record these sessions and these slides, and the recording will be posted on Easy COVID Education. And if you open up your chat, you can now see the link to today's presentation. If you have any post-webinar questions, please feel free to reach out to me, leslie.amani@cdph.ca.gov. Next slide. All right, I just wanted to announce on the next slide that we want to thank you for being attendees of the My Turn and myCAvax Monday office hours. We want to thank you for always joining CDPH. This session series was specific to share latest updates on system releases and vaccine availability, along with live demos and your questions and answers from CDPH. We really are so grateful for all you've done. And as we move on to the next slide, just wanted to give you a brief historical timeline. This is a loose timeline, but let's just see a little reaction if you remember the name COVID Ready, Prep Mod, or Interim CalVax back in 2020. If I see those coming up, that's a testimony to how long you've been on the project if you recognize those names, to be sure. And that did move into January of 2021 for My Turn Clinic and My Turn Public. In February, it was a transition from CalVax to myCAvax. And then March 2021, we have our first recorded session of March 8th, 2021. And since that time through the rest of that year, through 2022 and 2023, we've hosted 87 sessions, reaching 8,624 total attendees. So this has been that one-off special part of our week. We went weekly to bi-weekly with the hopes that you would feel supported as things transitioned and changed with My Turn and myCAvax. And I just wanted to say a special thank you to the historical names that many of you, again, might recognize, from Jill Zinke to, I don't know if you guys remember Eric being on the call, Eric Norton. We have today Hannah Shows, who has been your demonstration, as she says, your friendly myCAvax demonstrator every week. And we are going to miss this time with Hannah, who shows up always ready to rock and roll. And of course, today we are also welcoming and remembering the fabulous Josh Pocus and Dan Conway for all their work on this project. So we just wanted to take a moment to pause and thank those who have gone into all the slide deck preparation. There is a huge team behind these names that you see and the voices you hear on these calls. So just a quiet moment to say thank you to all who contribute to answering questions, prepping slides, and much more. And as this team wanted me to convey to all of you, the audience today, thanks to all of you for all the work that you've done and you continue to do. And I don't know why I'm emotional. I'm going to see all of you probably this week on the LHD and provider webinars, but we really do appreciate all of you. So we're going to move on to the next slide. And I'm going to turn it over to the team of Josh Pocus, Dan Conway, and Hannah Shows to kick things off with updates, demonstrations, and our subject matter experts are awaiting your questions using your Q&A icon. So Josh, I think I'll turn it over to you to start.
Thank you, Leslie. And I do remember Eric Norton bring me onto the project and saying, oh, it'll just be 3 months. You'll work on CAvax, interim CAvax, just for 3 months project. It's been a great, 3 years now. So moving on, let's talk My Turn Release 43. So this is all about the Bridge Access Program and commercialization updates that are coming. So on both sides of the house, the clinic and public, we are now implementing a supply that is focused on the funding source. So you'll see, we'll talk about it shortly here in a second, but you'll see all the vaccines will have the language public or privately funded. Now that will actually allow the patients on the public side to filter based on their insurance question. We did remove the option that they have insurance but can't provide the information, so that if they do select yes, they'll be forced to provide that insurance information to you. If they select no, their clinics will filter only on clinics that offer vaccine for uninsured. So either VFC, VFA, or BAP programs, whatever programs do that falls under, it's either publicly or privately funded. You'll also notice that when you go into your clinic information to update your clinic info, maybe update your availability for this new BAP program and maybe commercial products you're adding to MyTurn, you notice that the clinic phone number is now required. That is required because they will need to contact you or at least a member benefits line in order to verify that the insurance is accepted by you as the provider, so that they can manage any out-of-pocket expenses they will have. Also, we're adding the please contact clinic to confirm the patient's insurance is accepted. So that will show on all the clinics that have a private vaccine supply. Okay, we are also updating the reports to include that insurance information, so you'll be able to download that and extract the insurance information for those who have supplied it. Next slide, please. All right, so the roadmap, want to talk quickly about the public roadmap. Release 43, just talked about that. Release 44 is upcoming in October 25th. We are displaying, so we're a little behind on right now for the clinic phone number, we're having to do a workaround to add it to the description field. Our scheduling third-party application is going to add its own separate field, but their release timelines don't align with ours currently, so that field will show up eventually in October. But we will be adding it to your description currently. So please just enter the phone number in the phone number field in the clinic side. You will also do a public site refresh in October. For MyTurn Public, we're expanding the site navigation, the site map, and doing QA pages that are specific to each vaccine type and expanding those in the future. Next slide, please. On the clinic side, what you'll see when you go in there and you're doing your clinic creation, you'll see a new setup. So as you see in that screenshot, under the publicly funded or privately funded, you'll see all the different vaccine supplies you can add to your clinic when doing your clinic setup. Now, we have added some descriptions here that I'm not going to read to you. You can read later, but essentially publicly funded are vaccines purchased through government programs. Privately funded vaccines are purchased by you as the provider. That's the simple breakdown of those. Next slide, please. All right, my turn clinic roadmap. So October 25th, R44, we are beginning our development for a myCAvax. Official name is TBD at this point, but a myCAvax replacement solution. So essentially we're building a simple care direct upload that will be a inline and bulk upload for care, and we're rolling it out for all vaccines. That means all vaccines that care supports currently today are going to be included in that. And it'll be a simple upload, I think roughly 10 to 12 fields. Basic patient information, you'll be able to IIS edit those, but there will be no actual like medical screening information or anything like that. So, but you'll be able to upload all vaccines directly to care through myTurn. All right, we're doing some minor bug fixes, and then we're also updating the race and ethnicity values to align with care when those new values come out. And that is our upcoming roadmap items. Let's move on to the next slide. And let's talk the updated Novavax vaccine supply. So Novavax is not authorized right now. The new product that is going through FDA is not currently authorized, so it's still the original product, but we are aligning to our new privately and publicly funded. So please remember to add both of those, as that Novavax vaccine is still being used. So you'll see that you'll see a new Novavax supply item. Go in and delete the old one and add the new ones for private and publicly funded vaccines. Next slide, please. Okay, what to expect. So my turn. This is your checklist. This is your checklist for both the private funded and BAP providers. So whether you're a private provider that's going to be using myTurn or a BAP provider, a Bridge Access Program provider, you'll want to remove the deauthorized vaccine supplies that are currently deauthorized. You want to add all your new vaccine supply, add the additional inventory items, and mark those items with the current funding source that they fall under. You'll also want to leave the old vaccine inventory items that you will use to do historical uploads. Now, vaccine inventory does not feed the myTurn public scheduling side, so you can leave those for now. They are turned off for current use, but they will be allowed for historical uploads through bulk upload. So if you leave those inventory items on your clinic, you can still do historical uploads. Vaccine supply does feed the public side, so you do need to remove those so patients do not continually scheduling new appointments with the old deauthorized vaccines. Also, you want to cancel and update all your existing appointments. So if you are continuing to provide vaccines through myTurn, please update existing appointments. Our release is on the 20th, the night of the 20th. So once we get that out to you, it'll be on the 21st. You'll be able to use it. You can go in there and you can update all the current and future appointments to the new vaccine and notify your patients. Or if you're not going to support that vaccine or give that vaccine out, please cancel all those appointments. Also cancel any appointments that are currently in the system from now until then, as you cannot update those with the new vaccine supply because they don't exist yet. Next slide, please. All right, now I'll be handing it over to Hannah to do a full demo.
Thank you, Josh. Good afternoon, everybody. I'm Hannah, your friendly myTurn trainer, and we're going to go over a live demo of pretty much everything Josh just covered. So it's important that today you go into myTurn to remove deauthorized vaccine supply to prevent the public from booking COVID appointments for that deauthorized vaccine. We're going to go over how to remove deauthorized vaccine inventory as well, should you have that need. Then we'll look to the future state, which will be available to you after R43 goes live later this week, about how to add BAP and commercial vaccine supply. And then finally covering how you can quickly and simply add your clinic phone number. So as I begin to share my screen, as always, please continue to drop your questions in that double bubble Q&A. As my screen is loading, a quick call out that we are working in a test environment with test data, and I'm logged in as a clinic manager. So like I mentioned, it's important as soon as possible to log in to myTurn to remove deauthorized vaccine supply for all of your clinics that previously offered the COVID-19 vaccine. You're probably pretty familiar with this process, so please drop questions in the chat as it relates to this. We'll first navigate to clinics and select the clinic that we need to remove the vaccine supply and inventory for. We'll select the Mary Mauve Pediatric Clinic. Now, this clinic offered the previously authorized COVID-19 vaccine, and now we need to remove that supply. To do so, we'll navigate to the Vaccine Supply subtab and scroll down. Now, here we can see all of our vaccine supply, which we have 10 vaccine supplies, and we want to remove all of them as they are all the now deauthorized COVID-19 vaccine. To do this quickly and simply, I can simply click this checkbox at the top left. They're all selected and I can bulk delete. If I want to be selective, as in I don't want to delete all of my vaccine supply, I can go ahead and select them row by row and then click bulk delete. We'll go ahead and select all of them and click bulk delete. Now, what did we just do? We just prevented patients from scheduling COVID-19 vaccines for the deauthorized product at this clinic. If I don't have a need for historical upload using inline bulk upload, I can go ahead and remove my vaccine inventory as well. So if you want to continue to upload previously administered vaccine via bulk inline upload, please make sure that you keep your vaccine inventory for the deauthorized product active at this clinic. However, if you no longer need to upload any vaccine administration data to myTurn, go ahead and follow these steps. You need to remove the clinic inventories. To do so, you can come over here to the far right and click Edit or Delete. If you go ahead and click Edit, something that I would recommend is you can go ahead and remember the asset, so the Pfizer bivalent. Another way to do this is just simply click the clinic inventory name and be taken to that full page. Once you go to the asset, so if you simply click now Pfizer bivalent -C8907 or whatever it says for you under that asset tag, I want to set the status of this vaccine inventory from available to non-viable. So we'll go ahead and save. And now if I return back to this clinic, again, selecting the Mary Mauve Pediatric Clinic and going to vaccine inventory. Now, if I go here, when I delete this clinic inventory, not only will this inventory be deleted from my specific clinic, but I've also taken the extra step to mark that entire vaccine inventory lot as non-viable. You can go through and do this one by one. So that is how you can remove deauthorized vaccine supply and inventory. When R43 goes live later this week, you may want to add the BAP or Bridge Access Program or privately purchased COVID-19 vaccine to your clinics. We are basically going to do all of this again, except instead of deleting, we're going to add. So let's go ahead and navigate back to vaccine supply and click new. Now I am a myTurn clinic, as my myCAvax location is eligible for the Bridge Access Program. I'm going to select COVID-19 vaccines that are publicly funded because I participate in the Bridge Access Program and my COVID-19 vaccines come from that public funding source. If you are buying COVID-19 vaccine privately, make sure that you select -privately funded. As we can see, most of this information pre-populates. I'll go ahead and type in the current stock and the date of the stock count as today and click Save. And now I've created a new vaccine supply, which allows the public to book vaccine appointments for that specific type of COVID-19 vaccine. It hasn't showed up. Do you know what to do to get your vaccine supply to show up on this page after you create it? That's right. We'll go ahead and click the refresh button on the far right, and boom, there it is. Now we'll go ahead and go to vaccine inventory to be able to add this specific lot of that Pfizer BAP funded vaccine. I'll go ahead and click new, at which point I will need to create a new asset by clicking new vaccine inventory. And from here, I'll need to input the relevant information. So I'm going to say the asset name, which is Pfizer 19 plus. Just for me, I'm going to put the funding source as BAP, and then I'll include the lot number for the vaccine. The vaccine type is COVID. The brand is Pfizer. The presentation I'll have to select appropriate for the vaccine. And the product I'll need to select from the search bar. You can search by the product name. So if I go ahead and type in Pfizer, all of the active Pfizer products will show up. Now, as I know I'm administering a vaccine that is funded by the Bridge Access Program, if I search in the product field for BAP, the Pfizer and Moderna BAP funded vaccines show up, which makes it simple for me. So I will select the Pfizer single dose vials. I'll indicate the total doses I have of this lot. I'll leave the status as none for now, as you need to leave the status as none until you create the vaccine inventory. Select the account, copy that lot number that we inputted earlier. I will allow duplicate lot numbers by selecting this box, indicate the appropriate expiration date, and the funding source, which now we have the option to select private if you bought this privately, or I will go ahead and select BAP, as that is the appropriate funding source for my vaccine. When I click save, the asset is now saved, and I'll mark this clinic inventory as active. When I click save, there's one final thing that I have to do. We can see here my BAP COVID-19 vaccine clinic inventory has been successfully created. When I go to the clinic inventory name, I'll need to select the asset. And from here, change the status not from none, but instead to available. And that is how you would add the vaccine supply or vaccine inventory for the new COVID-19 vaccine offered at your clinic. And what was our last demo topic for today? Adding a clinic phone number. This is much simpler than the clicks that we took together as a group. So we'll go ahead and navigate back to clinics. Select the appropriate clinic. And here we can see the phone number field is blank. After Wednesday, the phone number field will be active. So please make sure you have the most updated information here as it is required. So we'll go ahead and click the pencil icon, type in the best phone number for this location, and click save. Truly as simple as 1, 2, 3. That concludes our demo for today, but before I pass the mic back to Leslie, Josh, do you have anything that you'd like to add?
No, Hannah, thank you very much.
Thank you, Josh, and thank you everybody for your time and attention. Leslie, back to you.
Thank you very much. Appreciate that demo. And Mary, your question, when will the recording be available? Well, it's usually available by late afternoon on the day of a webinar. At the latest, we try to get it out the next day. And just want to also highlight to the group, we are going to be putting into the chat the link to Friday's provider webinar, which offered a lot of valuable information on the vaccine closeout activities, ACIP meeting with Dr. Liu, and deauthorized vaccine information. So I'll drop that into the chat as well, but that would be a wealth of information for some of the questions that are coming in. But having said that, I am going to pause and I'm going to check in with our subject matter experts on the call who have been answering some questions and see if there's anything that you would like to bring forward at this time.
Hey, Leslie, it's Josh. I just want to call out a question from Annie. The inventory items, they're not connected to the myCAvax side of the house with the waste and reporting waste. The status outside of being active, it doesn't really drive any logic. It's more just a note for you and your staff, so you know what that inventory item is, if it's non-viable or if it's active or inactive. So it's that the active status is the only one that really drives functionality. All the others are really more for notes for you.
Thanks, Josh. Other subject matter experts? Okay, I'm going to go ahead and pause then and turn it back over to the presenters. And Dan Conway, I believe you are up next.
I am. Thank you, Leslie. All right, let's move to the next slide, please. All right, so we're going to talk a little bit about release 43 from myCAvax. I think you've probably heard this for a little while from Claudia and Maria in the other sessions. So this is our release to enable providers to order SGF flu and a few other changes in the system. So on the LHD side, the big change really is that as part of this release, we'll no longer be able to edit the shipping address fields on the program locations, whether it be COVID or SGF. The updates for the addresses will come from the location account, and they will automatically be reflected on the program locations if you're looking down at the program location information. Also, the address fields will be populated from the location account instead of the program location during the SGF enrollment. Next slide, please. All right, there's a lot of words here about the changes. Like I said, this on the provider side, and there's the big change will be the capability to be enrolled when you're enrolled in both the Bridge Access program and the SGF program. You will now on the landing page see two tiles will allow you to get access to ordering both through both programs. So a lot of the things that you'll see here is that the community side, there will be an updated landing page. If you are in both programs, you will now see two tiles. You'll also see a program selection drop down on various places of the system, especially around the ordering and the shipment incidents. And that's where you see a lot of these words explaining that these changes are going to be on the on that provided location. I'm sorry, community pages for you. If you are just in one or the other program, if you are just BAP or if you are SGF, you won't have the tiles. You'll be dropped directly into the program that you are enrolled in. And then everything will operate similar as it does today, as if you were just in the COVID program. But the big change is that it does now support, with this release, we will have the ability to support multiple programs if you are enrolled in such. So the other thing is that on the location account, that bottom right hand item there is that you'll have a substatus on hold, and the reason for the on hold field updated with the provider account changes when any of the shipping address fields are updated. So there's a slight change in the terminology on our reason for hold. All right, next slide, please. All right, so with our State General Fund ordering, this is a new functionality as part of this release coming up this Friday. So on Monday, the ability for providers to order SGF will be available. So if you are a provider who will be ordering the State General Fund flu vaccine in myCAvax, we want to invite you to come join us for a 1-hour SGF flu vaccine ordering 101 for providers, a webinar. And this session will be on Monday the 25th from 11 a.m. to 12 p.m. And we're going to be focused primarily on the navigation of myCAvax and placing orders. And then you also have an opportunity for a Q&A with the subject matter experts. If you are new, especially if you're new to myCAvax, this is a great opportunity to get that introduction and overview of how to navigate. If you are an existing user of myCAvax, this will also, you get a chance to see and walk through some of the changes that have occurred as a result of the release and allowing you to see multiple tiles. So if you are in both the BAP and SGF, as I was mentioned before, the landing page will be different and the navigation will be slightly different for you. So it's still probably a great thing for you to come in and go through this and participate in our SGF ordering 101 webinar on the 25th. Next slide, please. All right, a little overview our release roadmap. So we were just talking about our current one. I'll start in the middle. Passes, our R42 happened in August. This Friday is our release 43, as I was mentioning, and again, mostly on the SGF community side. When we go into release 44 in October, and the Bridge Access Program, we're going to do some updates with the data, primarily in the background. This will be things that allow us to separate our USG COVID transactions from our new BAP transactions that'll be in the system. The other things that we'll be introducing the additional SGF functionality, waste events, and the excursions. And then also the providers have the view and access to the SGF locations tab as well. Next slide, please. All right, so we're going to talk a little bit about the deauthorizing the bivalent products. So as you know, FDA approved and CDC recommended that we did the authorization of the bivalent vaccines. So we want you to please dispose of these vaccines immediately and report the waste in myCAvax. With our release last week of 42.1 on Wednesday, we deactivated all the USG COVID-19 program locations, and also enabling all providers, regardless of your COVID-19 program status, to be able to report waste and manage your inventory in myCAvax. So that went out on Wednesday to enable that capability. So if even if you're no longer going to be in the BAP program, we still want you to report your waste within myCAvax for those bivalent products. If you have any questions, please reach out to our provider call center at the email that you see on the slide as well. And they are here for support from Monday through Friday, 8 a.m. to 5 p.m. Next slide, please. All right, a little refresher on eligibility for the Bridge Access Program. Just as a reminder, if you're going to be a provider serving uninsured or underinsured adults through the public health department or an FQHC, rural health centers, tribal clinics, and an Indian Health Services site, you are eligible to participate in the BAP program. Additional providers can be deemed eligible by LHDs, and then they also may enroll in the BAP program as well. Next slide. And so the contact updates and completing the enrollment. So just to give you an understanding here, if you are a BAP eligible provider and you are having problems or you cannot access myCAvax, please contact our provider call center, and then they will confirm that your account is active and marked for BAP enrollment. Once you enter myCAvax, if you do not see the enrollment pop up, again, call the call center to confirm your contact settings and that you have the appropriate role. So the two roles that are eligible or are capable of enrolling your location in the BAP program, if you're eligible, are the organization vaccine coordinator and the primary vaccine coordinators for the location. And those are the two roles that are will receive the pop-up and are capable of enrolling your location in the Bridge Access Program. All right, next slide, please. All right, I'm going to turn it over back to Hannah so she can show us the information on the new tiles on the front end of our upcoming release.
Thank you so much, Dan. Hi again, everybody. I'm still Hannah, but I am now your friendly myCAvax trainer. And like Dan said, we're going to be looking at the new program tiles available to providers who participate in multiple programs in myCAvax. We'll take a look at a couple of different home pages just to cover our bases. So as I begin sharing my screen, I'm logged in to our test environment provider community, so working with test data. This first view may look familiar to you. In fact, you've probably seen it many, many times yourself. To our providers who are continuing to participate in the Bridge Access Program, this is what your COVID-19 dashboard will continue to look like. You'll have the ability to order vaccine, manage inventory, and manage your ad locations. And just a little lower down, you'll have your open orders, frequently visited Knowledge Center articles, information about the help desk. At the top, we have our community broadcast messages, and always your helpful home bar. If you're looking for something and can't seem to find it, always click more to see those tabs that were hidden, as the screen is simply not big enough to show all of the functionality available to you. Now, if you are a state general fund provider and you are only participating in the state general fund program, when the state general fund program goes live to you later this month, you will see this as your provider community homepage. So consider this a bit of a sneak preview. As you can tell, this looks similar to the COVID-19 homepage. It includes those tiles at the top and open orders, along with the Knowledge Center, information about our help desk, and at the top we have helpful tabs for you as well. Now, Hannah, I thought you were going to show us multi-program. What does it look like if I am both SGF and a BAP provider, for example? We will get there right now. So I'm simply going to close out of these two views and log in to my organization coordinator, who has the ability to participate in the Bridge Access Program and State General Fund Program. So here is that multi-program home screen. And if your location is enrolled in myTurn as well, you will also see a third myTurn tile here. From here, you're just given an extra page for some quick navigation. You can always navigate back to either the Bridge Access Program or the State General Fund homepage by simply clicking Home on either tile. If we go ahead and click Home on the State General Fund tile, for example, this will take us to that page that we just saw. But up here at the top, we have the Program Selected field, and I can easily navigate between State General Fund and COVID-19. If I participated in different programs, whatever I'm currently active in, I will see in the Program Selected dropdown. So again, this is not live to you today. If you log into myCAvax right now, you will not see this until our release goes live later this week. That is all that I have for today, but before I stop sharing my screen, Dan, do you have anything that you'd like to call out for our attendees today?
Again, Hannah, no, thank you so much. This is an exciting release for us as we start to move into a multi-program functionality in myCAvax. And again, Hannah, thank you so much for demonstrating our upcoming release. Again, this will happen this weekend and will be available on the 25th. And another plug for our SGF 101 webinar on the 25th as well. So no, thanks again, Hannah.
Thank you, Dan, and thank you everybody for your time and attention, not just today, but over the last 2 or 3 years that we've been together. It has been wonderful to be your friendly myTurn and myCAvax trainer on these Monday calls, and I know I'll see you on another webinar real soon. So thank you, everybody. Leslie, back to you.
Thank you, Hannah. All right, let's loop it back to some Q&A. We do have 22 minutes till the top of the hour, and therefore some time for your questions. And we can go ahead and enable raised hands if you do have a question regarding myTurn and myCAvax specifically. Feel free, I'll watch for raised hands to see if anyone has that hand up. But before I move that direction, checking in with our subject matter experts about questions you've already answered and topics you'd like to bring forward.
Hey, Leslie, it's Maria. Just a number of questions came in about disposal of the deauthorized vaccine, and just wanted to emphasize that you would continue to dispose of that as you have been disposing of all wasted products for the last couple of years. So please follow your local procedures. Once we get to Vaccine Now being available in the Bridge Access Program and VFC, for those of you that are providers there are returns to McKesson, but this deauthorized vaccine does not need to go back.
And Maria, this is Claudia. I think I also wanted to highlight a couple of topics generally. And one is the fact that I think we communicate a lot of information via email and via the webinars as well. So we did communicate information about the deauthorization of products and have shared that information. And I think we continue to make emphasis on this call to make sure that you are removing all of those deauthorized products from vaccine storage units. So if you have multiple storage units throughout your facilities, just make sure that everything has been removed, quarantined, and properly disposed of. Secondly, I think as it relates to the Bridge program, we have a number of resources that have been updated and a number of documents that have been created to guide you as BAP participants to the policies and guidelines for the BAP program. And I think in order to activate you as BAP, you had to go through some of those trainings, but would like to point out that the operations guide for the BAP program, it is a wonderful resource to refer for any questions that you may have about vaccine ordering, definitions, and all of that, as well as the requirements at a glance. It is a wonderful resource to be able to refer as it relates to that. And there is a new webpage for the California Bridge Access Program that a wonderful team has curated for BAP participants that includes all of those resources that are specific to the BAP program. And then the last thing I would say is that whenever we refer to the BAP program in myCAvax, this is really only referred to the adults program for COVID-19 vaccination. So everything else, if you are a VFC provider, you will be doing in the VFC system for vaccine ordering in myVFC vaccines. So everything that we do, inventory reporting, administration, guidelines really are applicable only for the adult COVID-19 vaccines and through the VAP program.
Thank you, Claudia. And I do see Santa Clara has a little bit of follow-up that a provider is still confused about the definition and whether or not first dollar coverage means the deductible would not apply. I'm gonna say probably the best thing is to refer the provider to the insurance companies. I mean, we're not we're not the insurance experts either, so it does get hard to answer some of these nuanced questions. But typically most insurance plans do cover ACIP recommended vaccines, and they aren't part of that deductible. But it would be really hard to answer that without knowing which insurance company and sort of the specifics. So, Claudia, unless you've got anything else to add to that, I think that might be the best we can do right now.
Absolutely. I totally agree with that, Maria.
Okay. I wanted to just add a follow-up question came in about the VFC and the return. So I just want to emphasize that all the deauthorized vaccines are part of the U.S. government COVID-19 program. So all of those vaccines that were deauthorized last week should be disposed of locally. As we move forward, starting sort of from now on, the new vaccines will be available through the VFC program for VFC providers to give to VFC eligible children, and then to Bridge Access Program providers to eligible adults, as Claudia was just discussing. So those newer vaccines will have new requirements for returned. So specifically, as we're talking about the deauthorized vaccines, those are the older vaccines, and those can all be wasted. Claudia, did I say that correctly, or anything you want to add there?
Again, Maria, I think you nailed it. Yep. Anything that is the deauthorized bivalent products, bivalent deauthorized products, Pfizer and Moderna, are to be disposed locally, and you report that in myCAvax. And any new product that you will be receiving from VOC, and new monovalent products you will be receiving through BAP will be returned to McKesson following instructions of both programs. But most providers have not received anything. Well, some have received some doses, so that's not totally true, but yeah.
Great, thank you. We did have a question about whether or not the new formulation has been authorized and okay to administer now. And so I just wanted to make sure that everyone heard the answer that that yes. And some of you are probably recalling that previously we were waiting for the Western states recommendation to be able to administer vaccines. And that group is no longer in place. And so now it's really just waiting for the ACIP recommendation and CDC recommendation, which both happened last week. So as you start to receive those new products, you can go ahead and start administering them. All right. Let me just check in. Josh, were there any questions that came up that you want to go over?
Sorry, Maria, I'm going back through them real quick. So in order to delete your clinic, just want to go over that one real quick. We can't technically delete a clinic because all of the vaccine records, so all the patients vaccinated are connected to that clinic. So you can inactivate it. You can remove your vaccine supply and inventory. It will not be available on the public side at all. And also you can manage your own users under the Manage Users tab or within the clinic itself. And you can deactivate those users by clicking Manage. When you click on a user, you can click Manage User button and deactivate them. You cannot deactivate combo users. So if the user is a myCAvax and myTurn user, you'll have to call the help desk to have them deactivated on the myTurn side. And we currently don't have a date field for the vaccine information statement published date. But if that is something you would like to see in the system, you can put in a request in on our link on our roadmap at the bottom of the roadmap. If you want to go back to that slide, Leslie, there is a link to provide information to our team for enhancements. So we'll take that and add it to our backlog and prioritize it accordingly.
Great, thank you so much. You would think after 87 of these, I would remember to mute myself before I started coughing, but sorry about that. And Bridget, yes, we see that you will put in the request. And now that we are going to be moving towards sort of our routine administration with vaccine information statements, I think that does sound like a good request. So get that in. We'll definitely take a look at that, right, Josh?
Yes, we will add it to our backlog.
Fantastic. All right, I think we got through all of the questions, but let me just do one last check. Anyone have anything else that has come to mind that they want to be sure to share with folks? Oh, one more just came in. If we purchase COVID vaccine, will we need to document in myCAvax? So no, you do not need to do anything in myCAvax for privately purchased vaccine. If you do choose to continue to use myTurn, of course, for the public or the clinic functionality, you are more than welcome and encouraged to do that. And you would follow the directions that Josh gave for making sure that that was marked privately purchased so that you can be sure to let patients know what source of vaccine you have. Anything else you want to add to that, Josh?
I was just going to jump in. Thanks, Maria. Yes, and you can also manage let's say you don't want to utilize our scheduling system, but you want to use myTurn and the public traffic it gets. You can set up a clinic as a third-party clinic. And when you click that checkbox on the clinic setup wizard, you'll have to enter in a URL and the users will be directed to your scheduling site wherever you send them. So that you'll be able to see it on myTurn, it'll show as available, and then they click on the button and then they will be redirected to your third-party scheduling portal. So please feel free to use that as well. If you don't want to use the full scheduling portion of MyTurn and just want to utilize the MyTurn page and for patients to find your clinics.
Great. And before I let you go, Josh, one more question just came in. Will the available vaccine inventory show all active vaccine inventory, flu and COVID? The locked filters default to COVID only.
I'm sorry, I'm not understanding the question. Apologies, Maria.
I think, Josh, if I can
Yeah,
hop
go
in
ahead,
here, I
Matt,
think
jump in.
it depends on what the patient signed up for. So if they signed up for flu, they'll see the flu inventories available. If that's what this question's referring to in the vaccine administration flow. And then obviously if they sign up for COVID, they'll see all of the COVID vaccine inventory that they are eligible for.
And Mpox, yes.
Yep, same goes for Mpox. So it'll filter by the vaccine that this patient signed up for. Yeah.
Okay, great. And speaking of Mpox, I'm going to turn it over to Marcia really quickly to make a comment.
Yeah, thank you, Maria. I just wanted to remind everybody, or tell you if you didn't know, with this new page layout coming this weekend, if you are a provider that orders Jynneos, you will go into the COVID program, and that's where you'll find the Jynneos on the ordering form. If you are a provider now that is not part of BAP or SGF, but still orders Jynneos, you can still log in, go to the COVID program, and you will find the Jynneos vaccine on the ordering form. That was it. Don't forget about Jynneos.
Yes, thank you, Marcia. We know it's seems a little strange, right? Go to COVID and that, but that's basically how it was designed to go under the COVID form. So we wanted to make sure you could still get to it. So I appreciate you saying that, because otherwise people might be like, what happened to my Jynneos product? Okay, I see a couple follow-ups from Christina. Let me just check in, Josh, Matt, anything else you want to add?
Got it. So that she's referring to the filtered view. So that is a view in Salesforce that filters on available vaccine inventory. So any of your inventory items that have been marked available, you can hit the drop down and change that view to all vaccine inventory. But that the view is based on the filter or the status of your inventory item. Does that help, Christina? It does include archive. It includes everything you've added for all time. Yes. So are you asking for a new view there? Is that what I'm hearing?
I was gonna
Okay.
say, I'm guessing that means a new view is what she wants, and she says yes.
Okay. Yeah, actually, if you want to just you can submit a request to us and send what view you would like to see. So would like to see flu and COVID under active. So if your flu and COVID are marked as active, they'll show up on available vaccine inventory if you hit that drop down. But if you do want a new view in that list, send us a request and we'll get that prioritized.
Great, thank you, Josh. All right, Christina has confirmed she'll send the request. One more for you. Should we delete account inventory marked unavailable?
I'm assuming they mean vaccine inventory. If you delete your vaccine inventory, you won't be able to do historical uploads. So the ones that are marked unavailable, they technically won't be used for any administration. But if you do want to make historical uploads for historical appointments through bulk upload, you should leave those. Once you delete them out of your clinic, you can't re-add them back.
Great, thank you, Josh. helpful reminder. Make sure you get all those historical doses in. All right. I think, Leslie, I think we've gotten to all of the questions.
Okay, I believe it. Oh, but just wait, there's more. You don't have to worry about asking another question. We may not have the answer, but I think these are some we're exploring. Maria, did you want to check in with Catherine's question or regarding insurance question?
Sure. If a patient had private insurance and has a deductible, they would still not qualify for BAP because they have private insurance. They aren't considered underinsured. That is correct. They are not eligible for BAP. And Claudia, if you were going to type something else, tell me.
I am confirming,
Okay.
not eligible.
Awesome. I always like to get the double check. We're all on the same page. Sounds like we are.
A big, bold thank you from Santa Clara. And let's just do a little informal check-in. We've got 99 of you on the call, our little 99 red balloons. I always think of that song when I see that number. So thinking of all of you and through the demos and through our time since March of 2021, if this has been a helpful series brought to you by CDPH, I see the emoji starting, so you read my mind. And I'm just grateful again for all of our panelists, Maria and or Claudia. I think we're just going to check in. Josh.
Yes.
One more item.
One more item real quick. Fresh hot off the presses, new update. So our contractor that works with the care team, they're going to be adding the new vaccine NDC codes for the BAP program. They may not be in by Wednesday when we do our release in my turn. So you may be getting some errors in the IIS edit function, but once they add those codes into care, you'll be able to resubmit and those will go through properly. So just want to let everybody know that if you don't freak out if you get IIS rejection errors or any errors in that IIS edit when you submit your new vaccination records. So care is working hard to get those updated and they should be updated shortly.
Thank you. With 3 minutes left, Maria, Claudia, any of our subject matter experts wish to make any other comments either related to the content or to our attendees before we sign off on this final session of the series?
Yeah, this is Maria. I would like to just say so many thank yous. I don't have enough time to say all of the thank yous, but to this team, to Leslie and the webinar team, to all of our subject matter experts who have presented and answered so many questions, to our wonderful Accenture team who has become like our IZ branch family over the last 3 years with developing systems and launching them in the middle of a pandemic and then doing hundreds of releases to just make them better week by week to respond to whatever craziness was happening. And then mostly to all of you for coming, for asking questions, for providing us feedback. It definitely has been something we've all been in together, and every question you've asked, every request has resulted in us continuing to improve these systems and enable us to do our best to support providers and patients in getting vaccinated. So just want to say thank you. We're not going away. We'll still be on Tuesday webinars with local health departments, Friday webinars with providers. And then as we release any large kind of new functionality, we'll definitely do ad hoc sessions so that we can make sure that we've got time to really show those to you and answer questions that you have. So just our eternal gratitude to you all for everything that you do. And that's it for me, Leslie.
Thank you, Maria. And Claudia just added into the chat, thankful for all of you and countless Monday lunch hours spent with us. Well put. Well, with that, as Maria says, we are not going anywhere. So we'll move on to our final slide with a reminder for our LHDs. We do have our Tuesday webinar. This Friday, September 22nd, the Friday provider webinar with all things bringing forward closeout activities, changes to the program. We invite you to attend those opportunities to hear more. And as we close out this final session of the series, again, thank you. Thank you for your time, your attention, your attendance, and we wish you all the best as we continue to work together to vaccinate California. And with that, we'll conclude today's session. Thank you.